I'm Joanna Hall, the CEO of Ultrasafe Ultrasound Diagnostic Services, and we are here at Dallas College with the privilege to be able to chat with Liberty Cowden, who is the program director of the cardiac sonography program here at Dallas College. Liberty, thank you so much for taking a couple of minutes of your time to chat with us so that we can understand what it's like from the sonography educator's perspective on how to account for safety in sonography when it comes to ergo-mechanics. Thank you so much.
Absolutely. Thank you so much for having me.
Oh, it's our pleasure. So just a couple of quick questions that we want to ask of you today so that we can get a better idea of what it's like from your perspective training some of the greatest sonographers in our country that are serving patients all over the place. Your impact on them creates a domino effect impact for patients all across our great state, our country, and globally. So thank you as an educator for what you pour into your students. Can you tell us approximately how long you've been scanning and in formal education?
Yes, I've actually been scanning for 20, going on 21 years now. And so I've been scanning for a rather long time and began precepting, I want to say, maybe like, let's see, 2004, something like that. So 17 years, and it's been a while.
That is a
Yeah.
while.
So that was precepting in the field, but formal education, 2005. So 16 years.
Some time, absolutely.
It's
And
been a
so
while.
now you're even here still doing education. You've done it during a pandemic. You've done it when everything around you you've had to account for dynamically in healthcare. You're not only an essential worker, but you're an essential educator. So I'm going to go ahead and give you a couple of great questions. First, as an educator, how important is it for your students to understand not only good ergonomics when scanning, but for them to understand how the biomechanics of their body are ultimately going to affect their career, both in the short term and in the long term?
It is so important. And here at Dallas College, we really try to focus on the importance of that because we know that when students invest time in learning those things, then they are making an investment that will pay off in dividends. And when I say invest time in learning the things, I mean specifically with regard to ergomechanics and things like that, learning the biomechanics of their body. It takes moments to make minor adjustments, which will set you up for success so that your career can be, lengthened by years, hopefully. And so students work very, very hard to get into our programs, and it's a great career. Um, and it can be a very long career if you take the time to, really concentrate on protecting yourself.
Absolutely, I 100% agree because even the statistics show us that you can become a symptomatic sonographer in just a couple of short years. And it can take a little bit longer than that just to get through your training. Whether you're on the job training or you're in formal education, it takes a commitment of time to be able to understand all that sonography has to offer. So by just taking a couple of cognitive moments to optimize those biomechanics and ergonomics, you can add years onto your career in ultrasound. So that's really wonderful that you guys here at Dallas College optimize safety in sonography in a way that includes the biomechanics of the body and the ergonomics of ultrasound. So thank you so much for
Absolutely.
those things.
Thank you. Well, the students work so hard to get here.
Yes.
And so that's one of the reasons why we really try to prioritize this right up in the beginning. As soon as they enter the program, start talking about ergonomics and biomechanics immediately.
Absolutely. And Dallas College is at the forefront of making sure that their students have access to all of the training and resources available so that their students can continue into this field and last for the long haul. So we appreciate all that Dallas College offers to their ultrasound students here in both the general program and the cardiac program. So, a big part of teaching someone how to scan is to physically help them maneuver the transducer into different positions. How does that affect your ergomechanics when you are physically putting hands on the transducer along with your students to help guide them in positioning and image acquisition?
So I start out by just giving them the grammar associated with all of these movements and maneuvers. That way, when we make it into the lab and we begin actually putting our hands on the probe and scanning patients, then they're equipped for me to be able to stand behind them and give them verbal instruction that they can relate to. And that sets me up for success in being a bit more ergonomic in my teaching, in that I can instruct from a distance and then they can accommodate.
Absolutely. Well, that's wonderful that you're able to have those tools verbally to instruct them how to properly move their bodies, because I know that being able to actually physically touch that transducer sometimes can add to the educators or even the preceptors' exposure to work-related musculoskeletal injuries. So how is it that you feel that affects your body as an educator when you are having to physically hold on to that transducer along with your students, when you're not able to have that verbal instruction and they say, "Hey, Miss Cowden, I can't find it. Can you help me?"
Absolutely. So, in my early days as an educator, I can actually speak to kind of what I did then versus what I do now. And in my early days, I found myself putting my hands on the probe a lot more.
Mm-hmm.
And so you're in a position where you're standing behind the student who's set up as a sonographer. Hopefully, you've coached them into a really ergonomic setup and position. But in order for them to be in an ergonomic setup, then you would be behind them and then you would be reaching out far in front of you. And so, that I felt that
Right.
in a big way. And thankfully, I didn't injure myself, but I would be so sore at the end of a scan lab. And so I had the privilege of being a graduate of the program myself, having some coaching on certain exercises that I could do to relieve that soreness and that tension. And so, I made use of it because I'd spent a lot of time learning sonography and learning how to kind of share the news of sonography in education, and I didn't want to lose that. And so, being able to verbally instruct is one of the biggest things. But now, there are not as many moments where I have to put my hands on the probe, and certainly we do have occasions where they say, I can't find it or whatever. And so, what I will do instead is ask them, to step away, and then I'll get into the position. I will demonstrate for them what I want to see from them, and I'll tell them to look at and kind of make a verbal marker of everything they see, where my hand is, how my, arms are aligned, how my posture is, and things like that, how I'm positioning the patient, whether or not I'm breathing the patient, things like that. And then we'll look at what's on screen, and then they have something to compare it to, and then I'll step out of the way and say, okay, now you do that and demonstrate. So that's one of the things. It's not that I never stand behind them at this point and attempt to put my hands on the probe or make a slight adjustment in what they're doing. I do, but in those moments I do try to get as close as possible. I let them know that okay, I'm going to come in behind you just a little bit, and but that's so minimized now, because I've learned that if I'm going to be able to continue to educate, then I really need to take the time to protect myself.
Absolutely. I love that you said that you have to take the time to protect yourself. And as a Dallas College alum myself, I was the beneficiary of all of the wonderful things that you guys do here. And there's a saying in ultrasound: see one, do one, teach one, right? And so being able to use your sonographic landmarks, being able to use your body landmarks to say, hey, listen, pay attention to all of your clues when you're scanning. Watch what I'm doing. Watch the way my body is. Take a look at the screen and take a look at the patient and see where you are. Take a look at the transducer. Is it subcostal? Is it in a longitudinal position, in a transverse position? Sonography is a very kinetic type of modality. So being able to use our auditory cues, our visual cues to optimize that kinetic movement that we have to account for is so important. So I love that you are able to make sure that you're taking care of your body first to be able to impart those tools onto the students so that they can go ahead and not only take care of themselves, but understand how to use the equipment to get the best images possible for their patients.
Sure. The other thing that, as you were talking, Joanna, I realized is that when I do have opportunity, like at the beginning of a lab where I'm doing a demonstration, I make sure to draw them into exactly what I'm doing that is setting myself up for success. So whether it's, hydrating throughout the day or, a particular position that I'm taking or how I'm scooting in closer to the patient, I'm verbally directing them to, hey, take note of this. And so then they're more equipped when they go sit down to the transducer themselves. And
Absolutely. I love that. But you're using those verbal cues again so that they can hear it and then they can do it themselves. Because like you said, there's so many different ways to account for how you're able to stay safe. And hydration is so important because of how much we use our muscles and how many different muscle groups that we're activating in the body to be able to say, hey, watch what it is that I'm doing, and then this is how you want to maybe perhaps even not do it, because sometimes it's important to also know what not to do, and that's where we go ahead and make those little cognitive efforts that take just a couple of seconds to create long-term good dynamic behavior in ultrasound.
we do that here at Dallas College. One of the things that we do in our ultrasound labs is sometimes we will, I'll break the students into groups and then I'll say, okay, pretend like you're doing this type of a scan or this type of an exam and set some things up that are improper from what, and then we bring the rest of the group in as like peer review, and then they come in and they analyze what they're seeing in the situation, and they say things like, well, the display is too high and you need to reposition the deck, or you're too far away from the patient, and things like that. And it really gives the students an opportunity to kind of serve as their own peer reviewers, and I think that's really beneficial.
Absolutely, because it doesn't always help to get those secondhand lessons.
Sure.
Sometimes you want to be able to go, okay, what is it that I can do myself, or even just amongst your peers, where it's not somebody where you feel is in a position of authority, where you can just go amongst your peers and go, hey, listen, what do you not see that's right here? What can you do better? So I love that you guys create that opportunity and that space between your students for them to have to critically think through those things to go, hey, wait, no, our equipment is not optimized. Our bed position is not optimized. Our ergonomics and our biomechanics are not optimized. And when they are not, how can we make sure that we're accounting for all of these different factors when it comes to safety and sonography so that they can be as successful as possible in ultrasound? So here's another question I have for you. If you can ingrain a takeaway into your students' minds when it comes to their ergo-mechanics, what would it be?
If I could ingrain a takeaway in my students, it would be that self-care is not selfish. And
I love that.
so many times in healthcare, people who serve in healthcare do so for the good of humanity. They want to help other people. And sometimes there is this perception that can be created whereby they think, oh, if I'm asking the physician to spend money on an ergonomic table, or spend money to get ergonomic chairs that height adjust or something like that. Maybe I'm asking too much, or I'm being demanding or something like that. And what I really try to convey is that self-care is not selfish. When you care for yourself, you're better equipped to care for your patients. You are better equipped to do a good job for your employer and to serve those who you're here to serve.
Absolutely.
So,
And that's kind of the golden rule, right? In order to be able to take care of someone else adequately, you want to first be able to take care of yourself. And there's absolutely nothing selfish in that. In fact, that's how we can best serve our patients, our providers, and our practices, by making sure that we are cognitively aware of these things, so that we can make sure that our minds, bodies, and even our spirits are ready to take care of another human being. Because we don't see patients at their best, do we? We see them when they are at their worst. And so we need to be at our best so that we can serve them in a way that helps them to get to their best.
right. And we all know that the longer that you're in sonography is one of those beautiful fields, and I'm sure there are many, but it's one of those beautiful fields where you never reach the pinnacle, and you're always learning, right? And so when you become a seasoned sonographer, we don't want you being down for the count because you're injured and can no longer practice, right? We want you being able to give back, to either step into education in a formal setting, like, what I've done, what you've chosen to do. We want you being equipped to be a leader in the industry, and to help train up the next generation of sonographers. And those sonographers that will care for themselves are better equipped to care for their patients. And so that's really what I want to pass on.
Well, that leads me to my next question. I'm so glad you said that. I want you to know, or I would like to know from you, what impact do you want to leave in the ultrasound industry as an educator, a provider, and now an essential worker?
What impact? That's such a great question, Joanna. The impact would be that, for me personally, I see the blessing and privilege of being able to take part in someone's education, like your own, as such a grand privilege. That is the way that I touch the future. I have had opportunity to be part of so many people's education, and I feel like, in my own flesh, I can only help so many people. I might, if I were in practice in a hospital in a day, touch, a certain number of patients and impact their studies and make sure that they got a good exam. But by doing what I'm doing as an educator, I feel like that's how I can reach more people. That's how I can ensure that, the sonographers that are, in the field are the ones that I would want doing my own scan, or my grandma's or my mom's. They're the ones who care, and that starts by caring for themselves.
I love that. That's so important, because it's what we impart on other people that they can then impart forward from there. So it's a very much pay it forward type of a mentality and thought process when we are giving of ourselves in healthcare in general, but particularly in sonography. You can't just read a book and learn ultrasound.
No.
It's very, very much community-based, tribe-based even, and we all kind of uplift each other. And like you said, I've been the beneficiary of those things, and I have learned those things in this establishment personally from you as well, not just as an educator, but as a mentor as well. So thank you for all that you have done, not just for me, who now I get to serve in sonography in a new way as an ally to not just our workforce members, but our employers as well, but to so many students that you're able to touch through your passionate educational skills. And we just really thank you so much for all that you continue to do in the field of ultrasound. Thank you.
No, thank you. Thank you. It makes me so proud. It makes me so proud what you're doing, and what you're doing here is worthwhile, and it's helping so many. And so, I just have to say thank you, because what you're doing too is extending the legacy of, Dallas College and El Centro, and, I just appreciate what you're doing.
Oh, it is my absolute pleasure. This is my alma mater. I am a graduate of El Centro College, now known as Dallas College, but forever known to me simply as El Centro. And if you want any more information about the programs here at Dallas College, go ahead and go to dccd.edu, and you can look up all of the information on how to apply to this particular program, where they not only teach all of the anatomy and physiology that goes along with understanding how the body works and how to scan it, but how to optimize your ergo-mechanics to take care of yourself and stay safe in sonography. Thank you so much for joining us, Liberty. Thank you guys so much for watching, and we will continue to give you all of the information on how to provide ultra-safe ultrasounds for the benefits of patient, provider, and practice. We'll see you out there.